Understanding peripheral ossifying fibroma. Essential insights for dental professionals. Did you know that a seemingly benign growth in the mouth can lead to significant complications if not properly diagnosed and managed? Peripheral ossifying fibroma is one such lesion that often goes unnoticed until it causes discomfort or dental issues. In this video, we'll explore the critical aspects of POF, its clinical presentation, diagnostic features, and management strategies, equipping healthcare professionals with the knowledge to enhance patient care. Peripheral ossifying fibroma typically manifests as a well-defined, solitary, and sessile growth in the gingival tissue. A recent case study highlights a 46-year-old male patient who presents with a growth in the lingual aspect of the mandibular premolar region, causing displacement of adjacent teeth. The lesion was non-tender and showed no signs of ulceration. Recognizing these clinical characteristics is essential for healthcare professionals to identify POF early and differentiate it from other oral lesions. With a clear understanding of how POF manifests clinically, let's delve into the pathological features that confirm its diagnosis. Histopathological examination is a cornerstone in diagnosing POF. In the discussed case, the excised tissue revealed perikeratotic stratified squamous epithelium overlying a nodule of cellular fibrous connective tissue containing abundant calcified structures resembling cementum. This mineralization is a hallmark of POF and distinguishes it from other reactive lesions. Understanding these histological features can significantly impact treatment decisions and patient outcomes. Now that we've covered the pathology, let's explore the demographic factors that influence the prevalence of POF. POF predominantly affects women and is most commonly diagnosed in individuals during their third and fourth decades of life. While the case study featured a male patient, this is less common. The lesion typically occurs in the mandibular premolar region, making it essential for healthcare professionals to be aware of these demographic trends, which developing targeted screening and treatment protocols. Recognizing these patterns can lead to early detection and intervention. Understanding the demographic leads us to consider the radiographic findings that aid in diagnosis of POF. Radiographic imaging, particularly cone beam computed tomography (CBCT), plays a vital role in diagnosing POF. In the case presented, CBCT revealed a well-defined hyperdense enlargement in the area of the lesion, consistent with the mineralization seen in POF. This imaging technique not only assists in diagnosis but also helps in planning surgical interventions. The integration of advanced imaging technologies is crucial for accurate diagnosis and effective treatment planning in oral healthcare. Now that we've covered the diagnostic aspects, let's discuss the differential diagnosis that healthcare professionals should consider when evaluating a gingival growth. When evaluating a gingival growth, it is crucial to consider several differential diagnoses to ensure accurate treatment. First, torus mandibularis, a bony outgrowth that typically form on the lingual aspect of mandible, usually bilateral and firm. Unlike POF tori, do not cause tooth displacement. Peripheral giant cell granuloma (PGCG), a reactive lesion that appears as a red or bluish exophilic mass, often associated with local irritants. Histologically, it shows multinucleated giant cells. Pyogenic granuloma is the third one. PG, an inflammatory hyperplastic lesion that can bleed easily and is often associated with trauma. It has a higher recurrence rate if local irritants are not addressed. Fourth, peripheral odontogenic tumor. This category includes lesions like peripheral calcifying odontogenic cysts and peripheral amyloblastoma, which can mimic POF. Other considerations, conditions such as fibroma, lipoma, and malignancy could also be considered, especially if the lesion exhibits atypical features. Understanding this differential diagnosis is essential for healthcare professionals to provide comprehensive evaluations and appropriate management for patients presenting with gingival lesion. Finally, let's summarize the key takeaways and their implications for healthcare practice. In conclusion, peripheral ossifying fibroma is a benign yet significant oral lesion that requires careful clinical evaluation, accurate histopathological diagnosis, and effective treatment strategies. Key points to remember include clinical presentation. POF typically appears as well-defined solitary growth that can cause tooth displacement. Histopathology. The presence of calcified structures resembling cementum is a defining feature. Demographics. POF predominantly affect women in their third and fourth decades of life, although it occurs in men. Radiographic findings. Advanced imaging technology like cone beam CT are essential for accurate diagnosis and treatment planning. Differential diagnosis. A thorough understanding of conditions such as torus mandibularis, PGCG, PG, and POT is crucial for accurate diagnosis and management. As healthcare professionals, being well versed in these aspects of POF is vital for improving patient care and outcomes. By fostering awareness and implementing comprehensive management strategies, we can enhance the quality of oral health services and ultimately improve the lives of our patients. Thank you for joining us today. Let's continue to prioritize excellency in healthcare delivery and ensure that we are equipped to handle the complexity of oral lesions like peripheral ossifying fibroma.